The main reason why high blood pressure or hypertension, the silent killer, exists is because of one thing. That one thing is that your arteries have changed. The arteries may change from stiffening, they may change from damage, they may change because it's not the same. How you were born, when your blood pressure was normal, something has happened and it's changed. And that change has led to the stiffening or the damage of the natural nature of the arteries. Several factors can cause this to happen, but the main reason why hypertension exists, and it's a silent killer because it kills people before even diagnosis, is just that one thing. The arteries have changed. You see, picture your arteries like the catapult, right? That device that you can attach a piece of a rock to, stretch it out to kill a bird or to kill a lizard or whatever kids play with. Growing up, the boys, especially in my neighborhood, used to play with a catapult a lot. It's a wooden handle with kind of elastic, stretchy rubber thing attached to it. And when you stretch it out and there's something hooked to it, it flips. And the more flexible that catapult is, the farther away that object that expels out goes. The same way is how the arteries operate. If your arteries are flexible, they relax more to receive the blood your body needs, and then they contract to push out the blood to the rest of your body. So when it's stiffened, that work becomes a problem. That functioning is impaired. When it's stiffened, you need to generate more pressure, which is more strength, to be able to squeeze that blood to the rest of your body the same way. And that stiffening can happen to the heart too. So if your heart is stiffened, your arteries are stiffened, it's from frying pan to fire, you are in trouble. And like I said in my other video, there are two main reasons why those arteries stiffen. One is metabolic, our own behavior, our sedentary lifestyle, our stressors, how we don't take good care of ourselves, we don't exercise, we don't eat right, we don't find time to sleep, we don't prioritize it, we don't prioritize sleep. The second is neurologic, how we respond to things in our environment, whether we're chronically responding to them as if, we are fleeing or about to fight chronically, that our body changes and modifies to suit. The arteries, whatever you subject yourself to frequently, your body adapts. So it's an adaptation. So your arteries adapt to that fight or flight mode because of chronic stress response. And that is the neurologic part. But the metabolic is our own sedentary lifestyle, the way we live, that is not conducive for a pliable artery. That is what causes us to have stiffened arteries and then develop this hypertension. So how to prevent it if you haven't had it already, or how to lessen the severity of it and make your life still, functionable, is to ensure that you exercise at least 30 minutes a day, every day. The exercise could be stretching, yoga, swimming, walking, whatever, anything. Move, okay? The second thing is to ensure that you give your body the building blocks it needs. So vegetables, make sure you eat your vegetables. It's very, very important. And then the third thing is to ensure that you sleep. Prioritize sleep. Very, very important. And then decrease your stress. Things you can't handle, let it go. Things you can, you do something about it within reasonable reasonable capacity to get it done, okay? And have a free mind. Don't stress too much, because trust me, for some reason, what I've learned in this life is that whenever you have something that is really on your heart, you want to get done, all nature, all the gods, all the spirits, whatever, come together to help you get it done. So don't stress too much about it. Something that really needs to be done and is aligned with, how you were designed. If it's in tune with you and you are supposed to be the one doing it, it will come to pass. Because everything is orchestrated, predetermined, so you don't even have to do anything. Sometimes we stress too much about things, but most of the things in this life have been pre-designed. We're just falling into it, getting it done. If you allow yourself to flow, for things to flow easily, it will happen. But sometimes we try to take things in our control, try to change things. Things are happening because they are preordained to happen. Sometimes there's nothing you can do about them. But then you stress, and cause you this high blood pressure. So that is the main reason why we have high blood pressure. And it's a silent killer because you don't see it. Sometimes you may not see symptoms at all. By the time you realize your heart chambers are damaged and it's not functioning adequately, and your blood vessels are damaged and not pumping blood out adequately. Therefore, you're not having the, nutrients, the oxygen, the hydration to the rest of your body, and you may suffer stroke. You may suffer heart disease like, congestive heart failure or heart attack. You may suffer aneurysm because there are bulges out of the arteries. They weaken and they bulged out like a balloon when there is a puncture and you blow it, and then, so anything can happen when your heart is not pumping right, because the heart is an organ that doesn't stop. It has to beat for you every time to get your energy. Even when you sleep, your heart is beating. When your heart doesn't beat, we say you're in a cardiac arrest. That it's a medical emergency. You need to be rescued. Some make it, some don't. So take good care of yourself. Don't stress too much. Don't let metabolic and neurologic things that you can handle, things that you can manage, things that you can do something about, impact you to have a high blood pressure. If you would have a high blood pressure, let it be aging. Aging is one of the factors you can't change. So they are non-modifiable risk factors, right? Aging is one of them. If you're aging and naturally your arteries are stiffening, there's nothing we can do about it. You take medications to mitigate, and enjoy your quality of life a little bit. And, if it's in your family too, there's nothing you can do about it. Genetics is also one of the non-negotiable risk factors, So if you have high blood pressure, let it be one of those factors and not, temporal things you can let go, or things you have control or means to let go. Don't let those things give you high blood pressure. Let it be the non-negotiable. If you smoke cigarettes, please stop, because it's going to stiffen your arteries, going to put you at risk for several cardiac complications. So smoking is one of the things you should stop. And drinking excessively, don't do it. It won't help you, especially if you want to enjoy quality of life. Life is about the quantity and the quality, right? If you want quantity and quality, then you have to listen to what I'm sharing with you, and let's work together, because I want to enjoy quantity and quality. Intentionally enjoy it. So we're making intentional efforts to enjoy those, but if you want it to be short, where you want less quantity, then the choice is yours. Everything, in this world, most of the things that we go through are based on our choices. So today, the choice is yours. Which one are you choosing? If you like this video, like, subscribe, follow me, because me and you, my dear, we're doing this life together.